So if we've exhausted the palliative, if we exhausted the chemotherapy and we have exhausted the radiotherapy session, and still we have the chemo cells rejuvenating or they're still becoming more rampant in your body, what comes after that mostly is the multiple organ failure. And then most people always ask the doctor, why have we done the chemotherapy? Why have we done the radiotherapy? And yet my patient is not getting better. We are not doing chemotherapy. It always depends on on at what stage has your patient come in. If your patient has come in an early stage, we can do a surgical incision which can be curative. Like for example, the cancer of the cervix, that one can be curative, can be cured if it comes at an early stage. But if it comes at a later stage where we have metastasis to the of whole system, whereby we have multiple metastasis after we have done the PET scan, and then we've identified that there are several nodes or there are several parts that are in other parts of the body, what we do is now we leave the curative part and then we go to the not the curative but the therapeutic. So we do the therapeutic care. So when you do the therapeutic care, you can either be started on chemotherapy or you can either be started on radiotherapy or brachytherapy or other immunotherapy. There's so many. So depending on what you can afford as well. So, if all of this has been exhausted, but your patient is still not doing better, we go to what we now call the palliative care, which is now you are treating patient as the symptoms come. We are treating as the symptoms come. And it is also something that we call giving a patient a decency in death. Most people don't like talking about death, but it's what we call decency in death. We don't want you to have pain. We don't want you to have multiple symptoms like having headache, having diarrhea, having vomiting, having nausea, because those are majority of the symptoms that comes for patients who are undergoing end of life care. So if we are doing that, then we are doing palliative care. That comes at the end. Okay,